Um, so dementias it's a term which covers quite a few diseases. And normally what we're talking about is conditions where some of the nerves in the brain start to wear out faster than they should do. And we don't know why it happens. And you get abnormal proteins laid down in the brain when you look under the microscope at the brain tissue, and it damages the nerves. And the symptoms patients get depends which part of the brain's affected. And frontotemporal dementia refers to a group of dementias where they start by affecting the frontal lobes or the temporal lobes at the side. And these parts of the brain are involved in things such as personality and language. So patients with frontotemporal dementia often present with changes in their personality or changes in their language comprehension or ability to form it. So primary progressive aphasias, or PPAs, are a group of dementias where nerves are wearing out, where the first symptoms are language problems. And the way they've been talked about over time has changed, and we base it on the symptoms the patient comes to see you with in clinic. So in primary progressive aphasias, there's several different conditions which all present with speech problems or language problems, but in slightly different patterns, and they represent damage starting in slightly different parts of the brain. So with dementias, what happens unfortunately is that nerves start to die back, and depending what part of the brain is affected, as I say, it gives you different symptoms. In frontotemporal, the main types are either based on the frontal lobes or the temporal lobes. If it begins in the frontal lobes, we normally call that behavioural variant. And people with that condition will start to have some changes in their personality. Sometimes they can become flattened and less emotional, less reactive. Sometimes they stop being able to read social cues as well, and they can become slightly more impulsive or disinhibited and say inappropriate things they would not have said before. Sometimes people start to develop changes in their appetite, and they start to like sweet foods more or become quite rigid and obsessed about the type of foods they like or other behaviours. So behavioural variant frontotemporal dementia affects people by giving them a change in how they interact with others. And they often don't have insight, unfortunately, into this, so it may well be people around them who are noticing the problem. When it starts in the temporal lobes and it's more language, people often present with not being able to find the right word, or not really understanding what things mean anymore, or sometimes they know what they want to say, but they can't articulate the words or form the sentences. So that's mainly how it affects people. With time, unfortunately, these conditions spread to other parts of the brain, and people will develop other problems such as memory problems, visual processing, a whole array of cognitive issues. So actually, it can be surprisingly difficult to diagnose dementias. In medicine, there's many conditions where you can simply do a blood test, for example, and it will give you a number. But it's not as simple as that when diagnosing dementia. So the mainstay of the diagnosis is always taking the history from the patient and those around them who have noticed changes, and trying to get a clear idea of exactly what's happened and over what kind of time period. We often use other tests then to add further information. So a common test to do is an MRI scan. Sometimes we do other imaging. You can see particular patterns on MRI which will fit with these different problems, but sometimes, especially early in the conditions, the MRI can look relatively normal. Another reason for doing an MRI scan is to look for other unrelated problems which could be potentially giving you similar presentations. Sometimes we do lumbar punctures. Sometimes we do detailed psychology tests to get a clearer idea of which parts of the brain are affected. And we put all this information together to come up with the diagnosis. Sometimes it can take a little time. So it's really, really sad with dementia that unfortunately at the moment we don't have any way of stopping it, and we don't have any way of slowing it down. There's a lot of trials going on looking at various treatments which may be effective for this in the future, but currently we don't have treatments to stop things. What we can do, however, now is with certain types of dementia, we can give people tablets that contain neurotransmitters, or we can give people tablets that stop certain transmitters in the brain being broken down, and this can boost chemical levels in the brain and sometimes help improve symptoms at the time. A lot of the management and a lot of the help we can provide is supportive and allowing people to access services that may be beneficial. I think it's really important to get a diagnosis if someone potentially has dementia, so that you know what you're dealing with, and you can know what's going to happen in the future.